Hi, I'm Dr. Bryan Friedman, board-certified ear, nose, and throat facial plastic and cosmetic surgeon. I'd like to discuss briefly an alternative treatment for chronic sinusitis. It's done in the office and it's called balloon sinuplasty dilation. It offers equal, if not better outcomes than your standard functional endoscopic sinus surgery performed under general anesthesia. It's done under local anesthesia in under an hour's time, minimal pain, minimal discomfort, and no significant downtime for your patients. To follow is a brief outline of the surgical steps. The first portion of the surgical procedure entails insertion of cottonoid pledgets into the nostril that are soaked in vasoconstrictive anesthetic solutions. After 20 minutes, the cottonoids are removed from the nostril and a minimal injection is placed into the nasal mucosa for further anesthetic purposes. After the nose has been thoroughly anesthetized, an instrument is utilized to medialize the middle turbinate to gain access to the frontal sinus and its drainage pathway, followed by the maxillary sinus. The balloon sinus instrumentation is then inserted into the nose and it is directed towards the frontal sinus and its drainage pathway. After being placed in the frontal recess, the balloon is then advanced and it is dilated. It is then deflated, further advanced, and once again reinflated. It is then deflated. The balloon is then removed, and an improved frontal sinus drainage pathway can be appreciated. The next sinus that is then addressed is the maxillary sinus. It is directed towards the maxillary sinus. After its placement is confirmed, the balloon is once again inserted and it is inflated. This allows the maxillary sinus opening to be further dilated, which allows for improved sinus drainage. The balloon is then deflated, further advanced into the sinus, and reinflated. It is then once again deflated. The balloon is removed from the sinus, and a more patent sinus opening can be appreciated. The sphenoid sinus can also be addressed in a similar fashion, followed by the contralateral side. I'm Dr. Bryan Friedman. Thanks again for listening to my in-office balloon sinuplasty procedure. Feel free to contact me with any further questions and referrals. Thank you.